What's up, friends? Welcome back to KimmyDTV, tips and tricks living your best life. In this video, I'm going to be doing a nursing school quarter 2 update for you all, specifically my quarter 2 nursing school update. So for those of you guys who may not know, I am in an LPN to RN bridge program, and if you are interested in seeing my journey, I did do a nursing school update for quarter 1. So if you guys want to check that out, you could check that video up above in the cards or in the description box, and I'll also add it as a comment for y'all. Ding! But anyways, without further ado, I'm going to start off by letting you guys know what my classes in this quarter 2 entailed. So I took human development for a total of 4.50 credits. I also took English 2 for a total of 4.50 credits, and I also took psychiatric mental health nursing for a total of 7.50 credits, and I also took, of course, clinicals. Okay, so in a nutshell, I can say that this quarter did require a lot of studying. It was intense, but it wasn't as in my opinion, hard as med-surg, because as you guys may know, med-surg goes through a plethora of the body systems, and it's just more broad, so therefore it requires a bit more studying because of all the body systems that you have to go through in med-surg. Okay, but nevertheless, I implore you and I warn you to please study as much as you can for this course, because I feel like, you know, a lot of people underestimated psychiatric mental health care nursing, and the thing is, you should not underestimate it, because the questions can be really tricky. Okay, so one of the mainstays in psychiatric mental health care nursing is therapeutic communication. For example, therapeutic communication can be very tricky because you can have two answers that sound very well, and one of them is actually the right answer, and it takes a mind that has studied, that has put in the work, that has practiced many questions in order to prevail on your test, because it can be extremely tricky. Okay, so that's the #1 advice I give for psychiatric mental health care nursing, is to please make sure that you do not underestimate this class. Okay, I've seen it, trust me, do not underestimate this class. It may not be med-surg, yes. The good thing about taking, when you get into your nursing program and when you get into the part where you're focusing on a specialty, like for example, labor and delivery is a specialty, pediatrics is a specialty, and psychiatric mental health care nursing is a specialty. The good thing about it is you can zero in and just focus on psychiatric mental health care nursing, but at the same time you have to be well versed in it, because there's only so many questions to ask, so you have to really know what you're talking about. Okay, so for example, you have to know your lithium toxicity levels, because you have to know the therapeutic range. It can be very slim, so you have to be well versed in that. You also have to know certain medications, like their side effects. Certain medications you can't take with, for example, with grapefruit. Certain medications, like with bipolar, it takes a few weeks to actually see the results, so you have to know your patient education when it comes to certain medications. You also have to know a lot of these psych meds cannot be taken while a patient is pregnant, and you have to know what some of these psych meds, also certain things decrease the effectiveness of the medication, for example alcohol. So you know, you guys have to be well versed and be ready to understand the different medications and find your way of studying those different medications, because they are important in psychiatric mental health care nursing. Okay, especially with your lithium levels, because that can be toxic to your patient, of course. Okay, so what else can I tell you about psychiatric mental health care nursing? I mean, I feel like you have to know the different diseases and what are the symptoms. Sometimes diseases may seem very similar, but they're not. You know, in general, in psych, it's hard to diagnose a patient because some of the symptoms can be really similar, but they're not. Okay, so you have to know about bipolar, the symptoms of bipolar, what would the patient present with versus how would the patient present with major depressive disorder or with anxiety disorder. So you have to kind of be able to characterize between those disorders and your nursing interventions that may follow. But I feel like the mainstay of psychiatric mental health care nursing is therapeutic communication. And stop thinking you know. I'm telling you guys, stop thinking you know, because you don't think, okay, well, I'm good at talking to people so I know, or I took a psych class and I know. Like, no, you don't. Please practice as much as you can, study as much as you can with those therapeutic communication, practice those questions, because you know, sometimes those questions can look very easy. When I bet you, when you're reading your book about psych, it may be very easy to read, you know, versus med-surg. Med-surg can seem like a bunch of gibberish, right? But when you're reading your psychiatric mental health care nursing textbook, it may be a bit easier to digest. But don't let that create a falsity in your mind and let you falsely think that the tests are going to be easy, because they're not, okay? So I don't want you guys to have a rude awakening on your first exam for psychiatric mental health care nursing. So that's why I say, please guys, I implore you to study as much as you can, okay? So that you can bypass this class and you can circumvent any difficulties that can appear, okay? So please all study, okay? So English 2. So English 2 was English 2. I'm good at English naturally, so it was easy for me. The only thing that was hard was, of course, trying to balance nursing school with English 2, because we had to read a lot of pieces of literature, but I did enjoy it. I had Shakespeare and sonnets to read and poetry, and you know, I always like English because I feel like it's sometimes it could be quite philosophical depending on the pieces that your professor chooses for you. But English 2 was English 2, and growth and development was growth and development. I had to learn about the different stages of, for example, Erik Erikson, infancy, trust versus mistrust, and several other stages of development throughout the lifespan, okay? So yeah, guys, that was quarter 2 in a nutshell. Oh yeah, and clinicals, I forgot. So of course clinicals was online. So clinicals was very interesting. It was very interesting to, you know, to interact with the different virtual patients. I got to see how it was like to interact with a patient who had bipolar or schizophrenia or any of the other diseases. That's another thing I wanted to point out. Like, I feel like taking psychiatric mental health nursing really busts a lot of myths and a lot of stereotypes that people have with people with mental health disorders. I feel like I learned so much more. I feel like we touched on it in LPN school, but not so much, of course, because, you know, it's a specialty. But I feel like I'm more awake when it comes to people with mental health disorders. I feel like TV and the mass media paints a picture of people with mental health care disorders, but when you actually study it and you see what they go through and you see that they're just normal human beings, a lot of times it's just chemical imbalances in the brain, or, you know, certain things, certain other etiologies that may erupt, whether it's genetics, environmental, so on and so forth. You learn to appreciate mental health care nursing because it dissipates any ignorance that you may have had towards people with mental health care disorders. So if you are walking down the street and you see someone acting, you know, out of the ordinary, you know not to judge them, not to point, not to laugh, but you understand that it is actually a disease. Even if you cannot see it physically all the time, it is actually a mental health care disorder. And I feel like we should all take mental health seriously. We should all take our own mental health seriously. So yeah, that's why I like the clinical, because even though they were virtual, I think that the virtual clinicals did a good job at portraying how these patients will actually act like. And I got a chance to, you know, document, assess, plan, chart. I got a chance to do all of that, and I liked it because I got to practice my craft of nursing and further install it into my brain, so that when I do come into contact with the actual real life patient with a mental health disorder, I'm more prepared to do it. And yeah, guys, I'm so happy I completed this quarter. I praise God that I passed. And you know, that's just my advice to you all. If I am missing anything, please leave it down in the comments down below. And thank you guys so much for watching. Don't forget to give this video a thumbs up, subscribe, hit the notification bell, and I'll see you in the next one. Bye.